we're going to go ahead and get started. So welcome everyone. My name is Elena Kidd and I'm a program director with the University of Alabama at Birmingham School of Public Health. And I'm very excited to welcome you to today's webinar, Appropriate Use of Disinfectants in Schools and Healthcare Settings, Quats, Hydrogen Peroxide, and Phenol, featuring Dr. Ziad Kazzi from Emory University. This webinar is made possible by the Alabama Regional Center for Infection Prevention and Control Training and Technical Assistance, or ARC-IPC, and is co-sponsored by the ARC-IPC and the Deep South Center for Occupational Health and Safety. The ARC-IPC was established to meet the consultation and support service needs surrounding infection prevention and control throughout the state of Alabama. The center is a collaborative effort of the Alabama Department of Public Health's Infectious Disease and Outbreaks Division and the University of Alabama at Birmingham. The ARC-IPC provides training and technical assistance to infection prevention and control in public health professionals in areas needed to detect, respond to, control, and prevent infectious disease outbreaks. And you can learn more about the center, view past trainings and webinars and podcasts, request training and technical assistance, and view infection prevention and control resources at go.uab.edu/ARC-IPC. And you can also email arcipc@uab.edu with any questions. And to stay up to date about future trainings, you can sign up for our newsletter on the homepage of our website. So we'd also like to thank our co-sponsor for today's webinar, the Deep South Center for Occupational Health and Safety. And you can learn more about their center and their upcoming events on their website. We'd also like to let you know about our recent podcasts and webinars around disinfectants. Dr. Kazzi's previous webinar on the basics of sterilization, disinfection, and sanitation, and 2 other podcasts can be accessed from the training database on our website, and the link is at the bottom of the slide. And please keep a lookout for additional podcasts around this topic to be published in the next few weeks. Continuing education credits have been approved for nurses by the Deep South Center for Occupational Health and Safety for this program. In order to receive credit for this training, you must register for the program, watch the entire program, complete the evaluation following the program, and upon completion of the evaluation, you'll be redirected to the Alabama CEU request form. You will also need to complete this form. CEUs will be awarded by the Deep South Center for Occupational Health and Safety. You do not have to submit directly to the Alabama Board of Nursing. And CEUs for this program will expire on January 18th, 2023. If you have any questions or experience any issues, please email arcipc@uab.edu, and we will place this email in the chat box as well. And finally, it is my pleasure to introduce our speaker, Dr. Ziad Kazzi. Dr. Kazzi trained in emergency medicine at Emory University in Atlanta before completing a subspecialty fellowship in medical toxicology at Emory University and the Centers for Disease Control and Prevention, CDC, in Atlanta. From 2005 to 2008, Dr. Kazzi joined the Department of Emergency Medicine at the University of Alabama at Birmingham, where he served as a medical toxicologist for the Regional Poison Control Center in Birmingham and the Alabama Poison Information Center. During his time in Alabama, he participated in numerous training activities like the Explosion and Blast Injuries course. Currently, he is the professor at the Department of Emergency Medicine and the director of the International Toxicology Fellowship Program at Emory University. He is also the assistant medical director of the Georgia Poison Control Center and a guest researcher at the CDC National Center of Environmental Health. He is the secretary treasurer of the American College of Medical Toxicology and the associate medical director of the Southern Regional Disaster Response System. As an emergency physician and toxicologist, Dr. Kazzi specializes in the recognition, triage, and management of poisonings and holds a deep interest in the areas of emergency preparedness, public health, and hazmat incident medical management. So without further ado, I would like to turn things over to Dr. Kazzi.
Thanks, Elena, for that kind introduction. And hello, everyone. I really appreciate you taking the time today out of your busy schedule to listen to us discuss disinfectants. I know we're all busy. The Omicron variant of SARS-CoV-2 is really impacting our daily lives, including absenteeism from work due to illness and excessive number of patients in the emergency departments and the hospitals. So I certainly appreciate you being here. And I hope that you will find this useful And again, I'm comforted by the idea that it's available online in a recorded manner to be viewed at a later time. Of course, all this material is available for you to use, and you can reproduce it as it's all in public domain. And feel free to spread this information amongst your colleagues. I will share my email at the end, so you'll be able to email me. If you are involved in social media, particularly in Twitter, where I have a presence, I would appreciate you maybe communicating with me as well via Twitter and following me, and I will follow you back. I'm going to go ahead and share my slides right now. This is going to be a presentation that follows the theme that we started on in our first webinar that Elena pointed out. The first webinar we had together was looking at the basics of sterilization and disinfection in the hospital and healthcare setting, as well as the school setting. But in that webinar, we also covered a very important disinfectant called bleach or sodium hypochlorite. We left for today's webinar a discussion of 3 additional chemicals: the quaternary ammonium compounds that we refer to as quats, hydrogen peroxide, and phenol. So essentially, this presentation is going to be going through these 3 specific chemicals, telling you a little bit more about them so that you can use them safely in your day-to-day work or life. Now, it's interesting to think back at this pandemic and what the medical toxicologist is doing to respond to this pandemic. Apart from being an emergency physician, as a medical toxicologist, I've been involved in educating and treating, preventing some of the toxicities that have emerged in the last couple of years, particularly some of the novel therapeutics that have been introduced into our clinical setting, as well as disinfectants. And naturally, a virus that has changed our lives forever is going to be mitigated by a variety of strategies, including disinfection. And when this happens, of course, you are going to expect toxicity that is going to increase because more people will use this chemical. The chemical will be available everywhere in our environment, which leads to accidental exposures and occasionally intentional exposures. And that's been shown through a variety of methods. And I would like to just highlight here the National Poison Data System, which collects data from the American Association of Poison Control Centers. And surely enough, they've reported an increase in the exposures reported to poison centers, to cleaners and disinfectants. So we have been involved in this project for over a year now. We're in our 2nd year of involvement, trying to educate about the safe use of these disinfectants that have become an integral part of our life. Again, today, at the end of this presentation, you will hopefully be able to really better use these quaternary ammonium compounds, hydrogen peroxide, and phenol, and know more about their potential toxicities if inappropriately used. If you want more information about these, I want to just disclose that I've been working with the American College of Medical Toxicology through a subcontract from the Pediatric Environmental Health Specialty Unit from the CDC and ATSDR EPA, Environmental Protection Agency, to educate providers and the public about the safe disinfectant use. And we have a mini webinar series as well as fact sheets. And we're looking forward to collaborating more with the ARC IPC. And hopefully you'll see more of that in the near future. Now, to first set the stage, I want to remind us all that what we are trying to do here in this situation with SARS-CoV-2 is low-level disinfection. And this is what I'm really focusing on my discussion on. There are different levels of disinfection, and we are really here concerned about this enveloped virus, SARS-CoV-2. And luckily for us, fortunately, this virus is not as difficult to inactivate as other microorganisms. And therefore, a low-level disinfection process or chemical is sufficient. Of course, we will be able to cover as well some bacteria in our process, which is a good thing. But remember, this is not going to be effective against spores or mycobacteria and some non-enveloped virus like norovirus. What we have covered so far, like I said, is sodium hypochlorite. But today we are going to go through phenol, quaternary ammonium compounds, and hydrogen peroxide, and do that hopefully with plenty of time left at the end for your questions and answers or comments. The public health agencies in our country have really been busy providing a lot of education on the safe use of disinfectants. And I want to really here acknowledge federal agencies like the Environmental Protection Agency, the Food and Drug Administration, as well as the Centers for Disease Control and Prevention. And here, you see through their funding, the Pediatric Environmental Health Specialty Unit, which is managed by the American Academy of Pediatrics, has provided numerous resources that can be used at a variety of settings like schools or hospitals, even for the public, about how to properly use these chemicals. And of course, some of the major lessons learned or major lessons that are educated upon are the appropriate cleaning before applying these disinfectants. And this is something maybe that is not obvious to you or may not come to your mind immediately, that why do I need to clean before applying a disinfectant? Certainly you need to do that because sometimes you have chemical reactions that occur between organic matter like dirt that is present in dirt and your chemical, releasing some secondary toxicants that can affect you as well. Of course, some of these chemicals are going to vaporize and expose people by inhalation. So remembering that ventilating the room is important when possible. And I understand that this is not always feasible. Some schools don't have specific ways to ventilate through the windows. Sometimes the window, just opening the window is not sufficient because there's not enough wind. You have to think about what is your ventilation system. Do you have a HEPA filter installed in the ventilation system? And we've learned a lot during this pandemic about the importance of proper ventilation and of proper air quality inside your your workspace or your school or your hospital. And that could be accomplished through proper air filtration. And I think that's a whole different topic that we can potentially discuss one day. Depending on the concentration of the product that you are using, in any case, it's a good habit to use goggles when you're dealing with these chemicals, and certainly gloves, because some of these are irritant to the skin, and some have a way to sensitize your skin and produce allergic reaction in the future. And most importantly, follow these label instructions that can be complicated. I'm going to try to teach you a little bit how to follow these label instructions. And again, the PACU program has provided some of these tools, and the Environmental Protection Agency has done the same. And really, they're very easy to use and widely available. Now, before the pandemic, the Environmental Protection Agency, in its concern for environmental impacts of the use of these chemicals, as well as in terms of their safety profile, had really designed a program, which is the EPA Design for the Environment antimicrobial program, that lists disinfectants that are safer to human health and the environment. And if you look at some of these disinfectants listed by the EPA, you find that chlorine, bleach, which is sodium hypochlorite, quaternary ammonium compounds are listed as the more toxic ones, as opposed to the less toxic hydrogen peroxide, in addition to citric acid, L-lactic acid, and ethanol. We will cover ethanol in a future podcast about about hand sanitizers. However, today, we are going to focus on the quaternary ammonium compound, hydrogen peroxide, and what's missing here is phenol. Now, these EPA listed chemicals are also categorized in the N list for disinfectants in terms of the activity against SARS-CoV-2. And that activity against SARS-CoV-2 is going to be sometimes based on evidence directly against the virus or other viruses that are more resistant than SARS-CoV-2 and therefore are expected to tell us about the effect of these chemicals on the coronavirus. Now, here's the snapshot of the database of the EPA DFE, Designed for the Environment Disinfectants, for your consultation. And here's the list, or here's a snapshot of the website where you can start looking at these disinfectants and looking at the N list as well. Now, the N list is a search tool on the EPA website that you have to know how to use. You have to really enter in that N list search tool the EPA registration number that you see listed on the right side of the slide. For example, 1234 is a number that will be listed on your disinfectant. So you have to go find it on your label. Of course, it is sometimes typed in a small font size, and some people like myself have a hard time doing that. So I often have to either use a loop or ask for a friend of mine to help me read it. But then once you look at the left side of that number, you enter it in the tool, and it will tell you what the chemical is here and how to use it safely. And that's essential to do when you are using these chemicals on a daily basis at your work or school setting or hospital. So I hope you can do that and practice with this process. The ARC IPC is currently working, I believe, on a toolkit that will be made available to you that you can use and train yourself and your coworkers on proper use of these chemicals. So now that we're done with the general introduction, let's go into the weeds and start with our first chemical, or quaternary ammonium compounds. We often call them quats for the quaternary, or quacks for the quaternary ammonium compounds. So you'll see me using those occasionally interchangeably during this part of the presentation. And you may have seen some of these products at your house, at your workplace, or at the supermarket. This is just an example of one that is delivered using wipes. And you can see closely here, if you get close to it, you see this long name that ends in ammonium chloride. That's kind of a hint about how to recognize that what you are dealing with is a quaternary ammonium compound. And you see the concentrations there, which are less important in this specific situation here. Although in some industrial settings, you may, or in the workplace setting where you use a lot of this chemical, you may have higher concentrations. But the ones you use in the household or the school setting, you probably find these low concentrations, like you see here, less than 1%. And if you actually look into the list, the N list of disinfectants, you'll find the quaternary ammonium compounds have 275 entries. Certainly a very robust list of chemicals. A lot of options here to use against SARS-CoV-2. And these are just some examples from the N list, and you see what it looks like. You have the EPA registration number that I mentioned, how to look up and enter into the N list. You see the active ingredient, the product name, for example, the company, the contact time in minutes, which is again an important lesson to always leave the chemical on for the recommended contact time so you can actually inactivate the virus. So if you leave it for less than 10 minutes, you may not have full inactivation of the virus, and what type of services to use it, and how it was tested against SARS-CoV-2 or another virus. Now, if you're into organic chemistry, you would recognize that this is a quaternary cationic compound because you have a positive charge on the nitrogen atom there, and you see 4 groups attached to it. That's what makes it a quaternary cationic chemical. It is surface acting, so it usually is applied on a surface where it acts on the microorganisms. And some of the better studied ones, although less commonly seen now for disinfectant purposes, is benzalkonium chloride. Another commonly used one is DDAC, which is didecyl dimethyl ammonium chloride congener, or DDAC. And all of these quaternary ammonium compounds disrupt your cell membrane of the bacteria or the lipid layers of viruses such as SARS-CoV-2. Now, remember, this is a low-level disinfectant, active against SARS-CoV-2 bacteria and fungi, but not active against spores or mycobacteria. Now, in these low concentrations, it is usually safe when it's used from the perspective of an acute toxicity. So these acute toxicities are very infrequently encountered with quaternary ammonium compounds. However, infrequently doesn't mean never, and occasionally you have some ingestions of these chemicals, whether accidental or intentional, and there you can see their caustic or irritant effect manifesting itself on the intestinal tract, on the skin, on the eyes, and on the respiratory tract. There are also some other rare toxicities with some of these chemicals reported in the literature that are outside the scope of today's presentation. What is more important for us today is the health effects of low-level repetitive exposure to these quats or quacks. These quaternary ammonium compounds, when you use them regularly, you have to be careful to use them properly. It's a really interesting chemical because it does cause dermal effects that we need to learn about today. It may cause some respiratory effects. we'll talk a little bit about any potential for reproductive developmental effect or cancer. The most interesting clinical effect of quaternary ammonium compounds are its dermal effects. This chemical is a sensitizer. It's well described in its ability to sensitize a person after exposure to this chemical in a way that you develop an allergic reaction when you're exposed to that same chemical at a later time. And this is really the definition of a sensitizer. And when you get exposed to it a second time, you can develop an allergic contact dermatitis, and you can even detect that with a patch test that you can do at an allergist clinic. Of course, people will have different reactions. Not every person will have this allergic reaction. It is increased in its risk in patients with pre-existing atopic dermatitis or eczema. Even without this allergic scenario, repeated exposure, especially to higher concentrations of these chemicals, can cause a direct irritation to the skin. By the same token, this chemical can cause sensitizer-induced occupational asthma. And remember, when you look at occupational asthma, you have to remember, step back a little bit and think about the two different types. One is sensitizer-induced, where you have an immunologic process that is ongoing. You get exposed to the chemical. You are typically asymptomatic upon first exposure. You develop the immune response and you produce the IgE immunoglobulin. And then upon re-exposure to the same chemical, you develop the reaction, which can manifest itself as an asthma with bronchoconstrictions, shortness of breath, and cough. That's different than an irritant-induced occupational asthma, which is not allergic. You can immediately have effects upon initial exposure that can cause bronchospasm, shortness of breath, and cough, and mimic an asthma exacerbation. Now, of course, sodium hypochlorite was discussed in that context as well, of sensitizer and irritant-induced asthma, and definitely more relevant for sodium hypochlorite because of the higher concentrations of vapor produced when you use this chemical in a poorly ventilated setting. Now, the good news about quaternary ammonium compounds is that they are less likely to cause vapors unless you are using them as a spray. If you're spraying the chemical, aerosolizing it in the room, now that's directly going to be exposing people via inhalation. But if you apply it to a surface, you have less vapors produced, therefore less exposure by inhalation to the people in that space. But that said, if you do have that exposure scenario of inhalation, you can exacerbate existing asthma, you can potentially induce asthma or develop asthma in non-asthmatics, and certainly are listed, these quaternary ammonium compounds are listed as an asthmagen and sensitizer by the Association of Occupational Environmental Clinics in their database that you can look up as listed on the slide. The good news is that both occupational asthma types, sensitizer-induced or irritant-induced, are treated the same way as asthma with bronchodilators and steroids, avoiding the exposure. And of course, always avoid spraying these chemicals where they are bleach or quaternary ammonium compounds. And if you can, look for a different type of chemical to use at your workplace. Can't emphasize enough the importance of leaving the chemical long enough to inactivate the virus. Be careful when you dilute it, because when you dilute it, you have to follow the instructions and you have to protect yourself from any potential splashes. Also use gloves, because it's as a skin sensitizer, you don't want to be sensitizing your skin, because next time you use it, you may develop the allergic contact dermatitis. And always try to ventilate the space where these chemicals are applied. Using a cotton or gauze pad to apply these chemicals is also not a good idea, because it ends up absorbing the chemical and decreasing the amount that is available to be spread on the surface. Now that I've talked about some of the issues with the quaternary ammonium compounds, let's talk about some of the better news that I have to share with you today. The first one is regarding reproductive and developmental toxicity. So if you're pregnant and using this chemical and worried about your ability to get pregnant or the health of your baby, the good news is that these chemicals have not been shown to have any evidence of reproductive or developmental toxicity. Whatever evidence is out there is not really translatable into a human exposure scenario. These animal studies expose animals to very high doses to a long duration of time. That is not what we use these chemicals for at our workplace. Same for cancer. Currently, the International Agency for Research on Cancer classifies quaternary ammonium compounds as group 3, which means that they are not classifiable as to their carcinogenicity in humans. So that's all about the quaternary ammonium compounds. Let's move on to hydrogen peroxide. And I snapped this photograph this weekend at work. And you can look closely and you see that this is a hydrogen peroxide compound, 0.5%. Now, hydrogen peroxide, you may have heard about this chemical. What we are using it for now as a low-level disinfectant is in very low concentrations, as you see here in the order of 0.5%. Even in these levels, you can even find it in mouth gargles. People even gargle their mouth with hydrogen peroxide containing solutions. The issues happen when you are dealing with higher concentrations, whether they are greater than 10%, 27%, 70% even. Those are potentially very dangerous. Anywhere between 3 to 9% also you can get in trouble if you have very high amounts that you're exposed to, or if you're using these inappropriately. When you look at the N list for COVID-19 disinfectants, you find 90 entries that have hydrogen peroxide, and here are some examples. And you will tend to find these also in healthcare settings, like the picture I showed you from our emergency department. The interesting thing about this chemical is its potential to cause severe toxicity when ingested or when used inside, mucosal tissues or inside wounds, especially in these concentrated formulation greater than 10%. And it causes the production of air embolism that you can see in a patient that I had at my hospital years ago who ingested a concentrated solution of hydrogen peroxide. What you see here on the CT scan is the air emboli in the liver. You can also detect that by ultrasound at the bedside initially when you assess the patient. And this requires, proper supportive care, including the use of hyperbaric oxygen therapy to repressurize these air bubbles that form. So certainly a unique acute clinical toxicity with these concentrated solutions of hydrogen peroxide, especially when inappropriately used. Again, some good news about hydrogen peroxide is that there are no known effects on the reproductive system or on the fetus. And in the same manner as quaternary ammonium compounds, the cancer risk is not classifiable, and it's listed by the International Agency for Research on Cancer as group 3. Last but not least, let's talk about phenol. Now, phenol may be a chemical that you are less likely to see on a day-to-day basis, although it's a chemical that we've seen for many years and has a lot of historical significance. But here it is. I found it at my hospital also over the weekend. And you see here a dilute form of phenol that is used to disinfect instruments or surfaces at the hospital. It is present in a variety of forms: lotions, ointments, gels, gargles, lozenges, and throat sprays. You may have remembered the lozenges, the camphophenic lozenges that are used for sore throat. It does have 29 entries when you look it up on the N list of disinfectants, as you see reproduced on this slide. And I just pulled here for you one of these products that are listed. I'm not endorsing the product, but I just show you this as an example. This is a safety data sheet of this product that you can see here contains phenols at 9% and 7.6%. And certainly in these concentrations, it is going to potentially cause some toxicity if inappropriately used, such as ingesting it or applying it to a intact skin or even an abraded skin. It is expected to irritate the skin in that manner. And here are also another formulation, which is wipes. And you can see if you look closely here at the concentration of the chemical, and I'm going to actually get closer, and you see the concentration is 0.28%, so much lower concentration. And you see how you can run into the risk of misusing these if you don't look at these labels carefully, and if you don't follow the proper instructions every time you deal with them. So going back in history to the more concentrated formulation like Crayolan, which contains phenol at 26%, you can get into trouble, particularly in the skin, where you have these burns that are typically anesthetic, as well as hypopigmented or depigmented. They also cause potentially caustic injury to the upper intestinal and lower intestinal tract, and may even have more systemic toxicity, such as central nervous system, depression, and paralysis. So again, these chemicals can be more toxic, especially in these high concentration. And even an exposure to the skin may require some particular consideration with decontamination, where water is not sufficient. You have to alternate it with something like polyethylene glycol or rubbing alcohol or isopropyl alcohol. Now, these scenarios, again, are these concentrated solution when you inappropriately use them. But it goes without saying that when you are using phenol at your work environment, that you make sure that you are wearing gloves, following the label instructions, wearing goggles, especially when there's a risk for splashes, and ventilating the room to decrease any risk from the vapors. Good news again from phenolic compounds is that they will have no evidence or direct evidence of reproductive of developmental toxicity. And when you look at their risk of cancer, you also learn that it is not classifiable as to its carcinogenicity in humans. So I hope you've enjoyed some of these learning points that I've went through today. I hope you feel more comfortable using these chemicals. Let's again summarize what we've learned today about quaternary ammonium compounds, hydrogen peroxide, and phenol. First of all, your quaternary ammonium compounds are going to be the most interesting from the perspective of sensitization. They will sensitize your skin and potentially your respiratory tract to develop an allergic reaction upon re-exposure. In the respiratory tract, it can also cause direct irritation, same for the skin, especially if it's a high concentration. It's also more relevant when you are spraying these chemicals in the room, where the risk of inhalation is higher. Remember that hydrogen peroxide is interesting because of its air embolism risk with concentrated solutions and inappropriate use. It is also going to cause some irritation to the skin and respiratory tract, but not as severe as sodium hypochlorite or quaternary ammonium compounds. Phenol, again, is an irritant, but it's interesting because of its effect on the skin with its depigmented burns that are also anesthetic. The good news for the chemicals today, they're all thought to be unable to cause cancer or not classifiable in terms of the carcinogenicity, as well as no direct evidence for effects on the pregnant woman and the fetus. I hope you've enjoyed this presentation. Again, this is my email that you can reach out to me with any follow-up questions or follow-up comments, and my Twitter handle @Ziad Kazzi. And thank you again for your attention, and I hope you have a safe and productive day.
And so we're going to open up the floor for discussion. If you guys have any questions that you would like to ask Dr. Kazzi, you can put them in the chat box. If you're not supposed to use cotton cloths or gauze to apply quats, what sort of, I guess, material would you recommend for applying that sort of chemical?
Yeah, so I was particularly talking about the pads that have more absorption. So I think you have to apply them somehow, as you said, but something with less absorptive capacity. And I can elaborate on that a little bit, Elena, since we have some time on our hand here, is that when you apply this chemical, it's a surface acting chemical, right? So it's going to have to interact with the virus, right? And then disrupt its lipid bilayer. And when it does that, over that 8 to 10 minutes after it kills the virus, you may have some residue there, right? And that residue is important because it stayed long enough to kill the virus, but it can also become a hazard itself, because this residue now on the table, for example, can bind to dust and can be, again, aerosolized secondarily in the room, leading to more exposures to the air we breathe that contains dust with these quaternary ammonium compounds. So that's one risk there. The other risk is when you spray it in the room, which is also an inappropriate use of this. I've also seen a lot of people using this chemical without gloves. That's, that should be a no-no, especially with quaternary ammonium compounds. I know we said kind of something similar with bleach, and phenol, and hydrogen peroxide, but I would say my top no-nos for using it without gloves is quats, and of course phenol. I would stay away from using these without gloves. But sometimes, you're working in the hospital, in the emergency department, and you just examine the patient with the SARS-CoV-2 infection, and you leave the room and you have your stethoscope or your goggles and you want to clean them up, and you're looking for gloves. You put the gloves on, you take the gloves on, and sometimes you say, yeah, let me just clean a little bit my stethoscope, and you reach out to it with your hand, and you don't always necessarily know what are you dealing with. Is this a quad that I'm using? Like I showed you on the pictures, it's small. It's written in small font, and it's difficult to see unless you ask the question.
We did have a question just about the web address for the EPA database for cleaners and chemicals, and have added that into the chat box. And so you can go there and launch. And Dr. Kazzi, you can just go over some of the things, some of the information that you can find there.
Absolutely. So the DFE list is for the chemicals that are safe for the environment and humans. Now that's one piece. Now the N list is where you find the SARS-CoV-2 chemicals. So the N list, you launch the browser, you enter your EPA registration number, which you'll find on the chemical, label, and you have to look for it. It says EPA label, okay, and then EPA registration number, and then you look at the number. It has two sides, a left side and a right side. You grab the left side and you enter that into the search tool, and you find it, and then you know more about it, how long to leave it on, and what is the actual chemical in there. And then we'll find the specific product, because it's very confusing. You go to Target and you find the same brand has all of these chemicals. So, and you don't know what you're reaching out to until you really do that research or look carefully. And I think that's important.
And I've definitely know from experience looking at the back of my Clorox container how small that, little number is and how hard it is to find.
Correct.
So please feel free to reach out to arcipc@uab.edu if you have any questions that you haven't been thinking about today, or if you need any information about our center, or if you have any questions about the CEUs presented. So once more, I would just like to thank Dr. Kazzi for being here to take the time out of your busy schedule to kind of go over this important information about quats and phenol and also hydrogen peroxide. So thank you so much for your presentation today.
Thank you.
Thank you. And we'll see you again next time. Thank you, everyone.